Welcome back. This is part 2 of the male pelvis. Here I'd like to show you the inguinal canal, how it is formed, and then the presence of spermatic cord and its contents, and relation of the scrotal layers with the testes. Okay, let's begin. Here the same thing as you have seen, this is the prostate. Okay, and behind you can see the coming of the vas deferens. Okay, so this light color tube is the vas deferens, and this is anterosuperior spine, and this is pubic tubercle. So this blue color structure is nothing but inguinal ligament. So you can see here how it is coming and forming. This is the spermatic cord content. Okay, so vas deferens is a content of spermatic cord. Before going for this, I'd like to tell you how the inguinal canal is formed. So as we know, anteroabdominal wall is formed by three important muscles: external oblique, internal oblique, and transversus abdominis. Please focus here. So from outermost layer, you can see three layers of muscle here. Okay, outermost layer is external oblique muscle, and from here onwards, this is the aponeurosis of external oblique. In between, you can see the internal oblique, and innermost is the transversus abdominis. Behind the transversus abdominis, you get the transversalis fascia. Okay, and little bit entirely you can see two more muscles, rectus abdominis and pyramidalis, and focus the light here, then it will be better. So it is attached to the tubercle, okay, pubic tubercle of the pubic bone of pelvis. Okay, so three muscles here and two muscles here, they form the anteroboundary, and just below that you can see a gap. This is called the superficial inguinal ring. This superficial inguinal ring is related to the pubic tubercle. Okay, any operation, if you have to go to approach the vas deferens or the spermatic cord, then normally this is a important surface marking. Okay, and here you see now, as I told you, this is the vas deferens. Okay, this is the vas deferens, which is related to the back side of the bladder, and already I have described in the male pelvis part 1, and it will be an important content of the spermatic cord. So it will flow through the inguinal canal. Now how the inguinal canal is formed? Entirely it is formed by the external oblique aponeurosis muscle, and roof also is formed by the external oblique aponeurosis. Okay, and floor is formed by the inguinal ligament. Posteriorly it is formed by the internal oblique and transversus abdominis, and partly conjoined tendon. Okay, already you have learned all this. What I want to show you is a gap which is called the deep inguinal ring. So superficial inguinal ring is a gap in the external oblique aponeurosis, while deep inguinal ring, if you see here, it is a gap in the transversus abdominis. Okay, you can see some vessels and nerve also, and this is the vas deferens entering. Okay, so this is a gap, and from this deep inguinal ring to the superficial inguinal ring, this is the inguinal canal. Okay, inguinal canal around 4 cm long. This inguinal canal will have content called spermatic cord. Along with the spermatic cord, there will be another nerve called ilioinguinal nerve. Okay, so this spermatic cord will come out from the superficial inguinal ring and flow towards the scrotum. So in the spermatic cord contains the vas deferens, which I showed you above here, and beside that you get the testicular artery, then pemphineform plexus, and genital branch of genitourinary-femoral nerve. Okay, ilioinguinal nerve is a content of the inguinal canal, but it does not come out from the superficial inguinal ring. it pierces the anterior layer before the superficial inguinal ring. Is it clear? Now you see here, once it reaches the scrotum, you can see the layers of the scrotum very nicely in this model. So this layer, a creamish layer, that is representing the skin. Then next you can see a blue line layer, that is the tarsus muscle. Then you can see the external spermatic fascia, then cremasteric muscle and fascia, then internal spermatic fascia. Okay, so this is the testis, and here a little yellow color structure you can see is the epididymis. Okay, so both the testis here along with the layers of the scrotum, and here only the testis with a few branches, nerve branches you can see. Okay, is it clear how the inguinal canal formation happens? Another important structure I would like to discuss here, this inguinal ligament, which I've been saying. You see the external iliac artery, okay, going down below the inguinal ligament and coming up the external iliac vein. This, as soon as it crosses the inguinal ligament, down below it will be called as femoral artery and femoral vein. In lower limb you have learnt as van structure, VAN, from medial to lateral. So this is the area called femoral canal. Okay, so here the nerve is not shown, which will be lateral to the artery. Femoral vein, femoral artery and femoral nerve. Now another structure you learned as femoral canal. So there will be little bit gap here. What I want to show you is this triangular structure, that is called the lacunar ligament. Whenever you study, this area is very difficult to understand. That's why I thought I'll show you in this model itself. So this is the lacunar ligament, which is attached to the pubic bone, okay, below the inguinal ligament. Okay, so this is all about inguinal canal, spermatic cord, and how the vas deferens from behind the bladder comes and enters the inguinal canal and then forms a part of the spermatic cord content and goes down to the testis. Okay, hope this model will help you to understand a lot more. Thank you.